We're talking today with Al Weber, president of Tweed-Weber in downtown Reading. Al, thanks for taking time today.
Thanks for the opportunity to say hi to you.
Now, I know a little bit about the research work that you do. Tell me, give me your elevator speech. What does Tweed-Weber do?
You know, we help our clients build and implement competitive strategies in their marketplace. And we do it in two ways. We do it through research, and we do it through strategic planning.
And how long have you been doing this? Well, how old is the company?
Tweed-Weber was founded in 22 years ago. So in 1991, I'm going to guess, is when Tweed-Weber came together. I had a private consulting firm. Steve Tweed had a private consulting firm. And we merged them together in 1991.
And what was your background?
My background was that I landed in Reading, and I worked for a company that sold and implemented management and supervisory and sales training programs. And one of those components of both of those was planning. And Steve Tweed had done a similar kind of thing in Oil City, Pennsylvania, and found himself here in the Reading area, eastern Pennsylvania. So we came together, we put our two practices together in 1991.
Now, so you come from the planning background, but it sounds like more of the work now is the research piece.
We started out as a planning company that did some research. And one day, and over time, morphed into a research company that does planning.
And with today, with all the data that's available by virtue of technology, I would imagine that's a rich field to be in.
Yeah, you know, whenever you look at research, there's two different kinds. You have primary research, which is where you're getting very specific research that is unavailable in the public domain. And then the secondary research. And primary research is when you go out and identify from a particular company's customers how they are viewed in the marketplace.
You talk to them on the phone, or you do email
yes,
survey.
Well, and again, form should follow function, so the question becomes, what is it that you want to accomplish? And we do a lot of phone surveys, but we also do a lot of online surveys, and we do focus groups, and we do whatever the right thing to do is to gather the information that the client wants. And but we do so we do a lot of research. But then the question becomes, how do you use the research that you gather in order to shape a direction for the organization?
And we just had a story on that about the challenge that companies face, because everybody's got access to a lot of information about their customers and their competition, but how do you make sense of it, and how do you use it to do what you just said?
Yeah, and the challenge is compounded by the fact that while in a typical year I read 80, maybe more research reports, and really know what to look for in those reports and how to assess them and how to pull the information that matters out of them. Not everybody has that wonderful opportunity to read that many reports on weekends. And as a result, many people pick it up and they read it, and while they're certainly capable of reading it and understanding what is said in the report, they may not know how to take it to the next level, and that is to determine how it's useful to them.
Right.
That's another big step.
What have you been working on lately? We were chatting just a little bit ago, and you mentioned some work you did for DCED about travel and tourism.
We did. We have worked with. We do some work with government. DCED is a client of ours, but we also do a tremendous amount of work with the private sector, with for-profit companies. We do a fair amount of work with not-for-profit clients. This time of year tends to be much more focused on not-for-profit clients because many of them just began their new fiscal year on July 1st. That begins to phase down a little bit. We begin to sort of work more now with working with our for-profit clients as they begin to get their plans ready for a new year for them, which will begin on January 1st.
Sure. I noticed that among your clients that you have some healthcare, you do some healthcare work.
Yep.
What's your sense of, first of all, what kind of work have you been doing, and what are you hearing about trends in healthcare?
Yeah, healthcare is getting very expensive. You may have noticed that already. And of course, right now it's up in it's in a period of unrest. because many people are still trying to figure out what impact the Affordable Care Act is going to have on them and what their business model and how they do business. But by and large, the folks in healthcare are very busy. A growing population, which we are in, means more and more people needing healthcare. There are incredible constraints on cost, or efforts to get costs under control. That's a better way to put it. A lot of people are entering the business. There was a time when there was a severe, really problematic nursing shortage. It seems to have eased a bit. And in our part of the world, we seem to be able to find most of the medical professionals that we need. Other parts of the country, that isn't the case. It's hard to get some people in some different parts of the country.
On the healthcare, there's all this effort now to do things like improve patient satisfaction, and to gather and convert to electronic medical records.
Yep.
What does that do for somebody in your business in helping healthcare clients?
Well, again, information has become an essential component to delivering high quality care. And whether you are doing it as a hospital or a home health care agency or a DME organization, or whether you are in a related field, such as long-term care. I spent yesterday with a significant, very large organization that works with the intellectually and developmentally disabled. And there's a huge amount of health care that is delivered to some of those folks, because many of them are, for instance, medically fragile. And so health care is impacting, it impacts a very wide range of organizations. And it does so in many different ways. Some people are, or segments are incredibly competitive. The home healthcare industry, as a good example, is a very competitive industry right now. And others are less competitive, just because the nature of that segment within a marketplace isn't quite as demanding.
Do you have an example?
Hospitals compete, there's no question about that, but they don't compete in the same way that the smaller organizations compete. So, the Reading Hospital, it's a great organization, competes with, for instance, here in town, St. Joseph's, which is another great facility. I've got frequent flyer miles at both of them. They're both great organizations, but they do compete. But it's very different than It's very different than some of the segments in which the barrier to entry is much lower.
Right.
It's not easy to say, we're going to start a new hospital today. But someone could say, we're going to start a new home health care agency today. And it could be in operation very quickly. Maybe not tomorrow, but within 30 to 60 days. And so, or a durable medical equipment company, or any of those kinds of things.
Yeah. One last question. The data gathering has been in the news recently with the issues with Snowden and the NSA leaks. What's your thought about all of that? Is there a line that the government, working perhaps with private companies, should not be crossing in terms of its monitoring and information gathering? And I was curious about what you thought about that.
The minute we sort of trip into the political end of that, I sort of get into a space where I probably don't know enough to be able to make an intelligent comment. What I can tell you is, when it comes to data, we have to realize that the level of privacy we might have thought we had as individuals at one point in time simply doesn't exist anymore. I don't know how many cameras there are on Penn Square, but let's start by saying several and count up from there. Every time you walk into a Wawa to get a cup of coffee, 6 or 7 cameras are taking your picture. Every time you go to an ATM, smile because you're on what's really a not-so-candid camera.
Well, we saw all that through the Boston bombing investigation.
And
those guys were tracked on camera all through.
And the one that got them was sitting on top of the Lord and Taylor store, which is right there in the, the Copley Square area of Boston. But that was the one that was the first one that picked them up. But they're all over the place. You are backed up, you personally are backed up somewhere in the world, probably on 100 different cameras in the course of an average day, every night. And those recordings are kept for some period of time, 60 to 90 days, before all of a sudden they come to the conclusion that, well, we don't need to know any more about Dan, so they'll erase you at some point, only to be replaced, of course, by the next day's worth of pictures. It's a generational thing. We do know that younger people seem to care less about it than older people do.
Sure.
That doesn't mean they don't care. They just seem to care less. But there is a tremendous amount of data. The amount of data stored in 2012 exceeded the amount of data stored every year prior to that added together. We are doubling our data stored almost every year. Now, is there a tipping point? Yeah, probably. There's a point at which I think that the data that we keep on people they're all going to put so many cameras in Penn Square, and so there won't be more that has to be stored. But in 2012, we stored more bits of information than we did in every other year put together in the history of man. Stored data. That should tell us that, every time you walk anywhere, there's someone out there that's watching you.
And on that unsettling note, I think we'll end this conversation. Thank you.
You're welcome.